Welcome to the Besties with Breasties podcast. Sarah Hall here. I am a certified health and wellness coach, athletic trainer, mom, and breast cancer survivor. I help women overcome their own mind drama to make mind shifts that open up the possibility for their most empowered and energetic life.
And I am Beth Wilmus, author, speaker, and founder of a human investment organization, otherwise known as a nonprofit, called Faith Through Fire. Our mission is to reduce the fear and anxiety that breast cancer patients feel and replace it with hope and a path toward thriving.
This podcast is about our experiences with breast cancer
and life after as young survivors and moms.
Hello.
Hello. I am so excited about this episode.
I am too.
It has been showing up for us at Faith Through Fire all over the place.
Yeah, in more ways than one.
We need to address it exactly. Today we're talking about ctDNA testing. Do you know what that is?
Yes. Yeah.
Of course we do. Sometimes it's called like a liquid biopsy test, and it measures small fragments of cancer DNA cells that are in the blood. So basically what's happening right now, what we're seeing...
Is it circulating tumor DNA or is it cancer tumor DNA?
It's cancer DNA.
Okay.
It's cancer cells.
Okay.
So basically what cancer patients are doing, and we're seeing this at Faith Through Fire all over the place, is they are taking these ctDNA tests after they get done with their active treatment. And it measures if there's still cancer cells circulating in the blood. And
it's like
let me ask you
being
this.
offered as a, would you like to see if you have
still have cancer in your body?
Yeah, if you still have cancer. Yeah.
Can I ask you, would you ever do ctDNA testing?
I would really have to consider it, but I think if it was just very bluntly offered to me with no
to do,
if it had been offered to me when I was going through treatment early on, I might have considered it. But now, knowing all the things that I know, I would really have to think about it.
I have
Actually,
an issue.
now it's a hard no.
It's a hard no for me too.
Yeah.
And this goes not just for ctDNA tests related to my cancer diagnosis. For me, this goes into I wouldn't get tested for Alzheimer's because right now we don't have any kind of cure for Alzheimer's, or
right.
I wouldn't get tested for pancreatic, which doesn't currently have any kind of treatment or cure. I am not traveling down the road of
worry over something that may or may not happen.
And I'm excited to talk to our guest today because she's a doctor and I want to know her perspective about this in so many different ways.
Yeah.
So today we have a guest, Dr. Cynthia Aks, who is an integrative surgical breast oncologist. And we're going to be talking about why do patients or doctors order ctDNA testing?
And some potential benefits and limitations of the tests.
And then the emotional and practical implications of receiving these results.
Yep. So before we do that, let's hear from our first sponsor.
Are you feeling scared, overwhelmed, or lost post-treatment? Do you want to reclaim your life and thrive even better than before breast cancer? Faith Through Fire Survivorship Bootcamp is designed for breast cancer survivors who are committed to living their fullest lives. If you're ready to leap forward, seize personal growth, and redefine your journey, this bootcamp will provide the path. You might benefit from our bootcamp if the excitement of completing treatment has worn off, leaving you feeling unsure about your future. You feel confused by your new post-cancer identity and struggle to accept your, quote, new normal. You want to enjoy life again but feel stuck in a cycle of negative emotions. Or you feel disconnected from yourself, others, or God. Our bootcamp offers a structured roadmap that delves deep into 4 key areas crucial for post-cancer recovery and thriving: understanding trauma, cultivating a fighting spirit, managing anxiety and intrusive thoughts, and redefining and reshaping your identity so you can rediscover your joy and purpose in life. You can participate in person in St. Louis or online. To join our waitlist, visit faiththroughfire.org/survivorship-bootcamp. All right, Dr. Cynthia Aks is an integrative breast surgical oncologist with over 30 years of experience in breast disease care, specializing in cancer risk assessment, genetic counseling, and integrative healthcare. She's certified in oncology nutrition, yoga therapy, Reiki, and cancer exercise. And Dr. Aks combines advanced surgical techniques with a holistic approach to healing, which is why I love her. She was a pioneer in cryoablation for breast cancer in Oregon, and she believes in addressing the root causes of illness, emphasizing the importance of understanding patients' physical, emotional, and environmental factors. What I think is really interesting, something she said that really struck me was People say I'm sick because I have cancer, and the reality is they have cancer because they are sick. And I thought that was really just told me a little bit about her mindset related to disease, which I think is really unique for a provider. She says that basically their mind and body has been in a state of imbalance for a long time. And so her approach empowers patients to restore balance and achieve long-term wellness. Welcome, Dr. Aks. Thank you so much for being on today.
Oh, thank you so much for having me. It's my pleasure.
I want to jump right in. Why do you think patients and doctors are choosing to pursue ctDNA testing?
Well, I think that technology has allowed us to get better at trying to customize care for people in broad terms in medicine. And so in the realm of oncology, we want to do a better job at trying to detect cancer as early as possible. And I think this is one way that we may accomplish this.
Are there specific types of cancer or stages where this test you think is more beneficial than others?
Well, my understanding, I just treated breast cancer, but my understanding was that it really started out earlier with liquid cancers like blood cancers. And then for metastatic disease, they started using it to identify recurrence. I think it's a potentially really good tool for those cancers that are really hard to detect early, such as pancreatic cancers.
Yeah, Sarah and I were talking about it before you came on, the pros and cons of this test. And one of the things I could see it being potentially useful for metastatic patients in order to really follow the progression of the disease and try different therapies to see what works versus what doesn't. It feels a little bit different, though, when patients are not metastatic, because what we're seeing through our nonprofit is that patients are getting done with their active or primary treatment, and then they're taking the ctDNA test. They're finding out that they have active cancer cells in their body circulating around, but there's not necessarily anything they're being instructed to do about that, and it's causing a lot of mental upheaval. So that's kind of why I asked that question, because I could see potentially some value in metastatic disease where the patient already knows that the cancer has formed tumors in other parts of their body, but how does it affect patients mentally who aren't there yet? And is it a guarantee that just because you have circulating, tumor DNA that you're going to become metastatic? Because we've had some patients whose doctors have told them that's the case. And I kind of push back on that concept that just because you have floating cancer cells means it's going to turn into metastatic cancer. What are your thoughts?
Well, I agree with that. But getting back to your first question about the emotional aspect, as you well know, a diagnosis of cancer is very emotionally charged on many fronts. So we're already dealing with people that have had that, quote, emotional trauma and going through all that they and their family have gone through with the diagnosis and the treatment. And then, there are some individuals that they have underlying mood disorders to begin with. And then there's those individuals that are really proactive and emotionally stable and want to do everything they can and be ahead of the game. So I think number one, it's important to really know your client, your patient, their emotional state, what they would do with the information. Many times when I use this, I had to spend a lot of time counseling people. I feel very strongly about informed consent when it comes to these types of tests. And I'm not sure all patients are really advised of the implications of, what the test results might show. There are false positives and false negatives. But with someone who has been through treatment and we're monitoring their liquid biopsies for any sign of recurrence or coming out of remission, it might be a way to reiterate to that person what are things that they can do to optimize their immune system so that the immune system can then destroy whatever circulating cells are there that haven't landed and started to grow and become a viable tumor. I think there are some people that use that as a proactive tool and say, where can they tweak their lifestyle and their environment and their nutritional choices to really boost up their health and their immune system. But you're right, there's people that you got to peel them off the ceiling. Was like, oh my gosh, my tumor cells are increasing, but I've gone through this workup. We can't find anything. What do I do? And they're living their life in fear. And that's not the intention of these tests.
Yeah, and it feels like a lot of providers are also not providing them any direction with, now that we have this, now what? What can you do? And they are just left in their worry.
I think your point is so important about really assessing the patient's mental health and counseling them on what they plan to do with these results, because that's exactly the benefit I would see, is that if I took this test and found out it was positive, it would be a huge motivator for me to make major lifestyle changes. And Sarah and I have found at Faith Through Fire that while most people say they want to make changes to their health post-diagnosis, most people struggle to do so. And I think physicians see this as well. I'd be curious your thoughts on that. How many patients really use a significant diagnosis as a catalyst for change, and how many are so stuck in those same routines that they keep following the same unhealthy behaviors that they've always had? What are your thoughts on that? How often do you think patients make major changes after a health scare?
Well, I think the majority of patients I've treated over the decades were initially very motivated, but the reality is it's really hard to make changes in habits that you've had for decades. It's not an easy task. And, our society has all been about, since the Industrial Revolution, it's all been about convenience and quick fixes and a pill for the ill. Whereas as we're learning with medicine and the paradigm shift and taking charge of your health, it's really about learning how to, first of all, do motivational interviewing with patients, which we're not trained in medical school. We have very little training on behavioral modification and interviewing people and trying to find out what motivates them, where's their obstacles, where can they get them, inspire them to make small changes, which are going to be more likely to be sustainable than bombarding somebody all at once and all these things that they have to change. And that's where I find people fall short is, they're coming in, they're in a fear state, and we start talking about nutrition and sleep and exercise and lifestyle and personal care products and all those things that could add a toxin load and weaken the immune system. And they start to make all these changes, but it's exhausting and it's not sustainable. So
I also think that the piece of it too is that it sounds like in your practice and in your work, you are very focused on, having these conversations with patients and making sure you do it in a way that feels achievable. But how difficult is it for a doctor in today's framework to really spend that much time with patients? Like, do you feel like that's, yeah. I mean, that's the thing. I mean, if you talk to any patient right now about how much time their doctor's spending with them, really learning what their potential toxic load is and what their lifestyle is, their existing lifestyle, so that they can maybe counsel them on a better approach. I mean, I don't know. How many doctors do you think are doing this and are able to do this?
Not enough. I mean, the reality is our Western medical model has changed since I've been in medicine basically my whole life. I didn't sign up for the type of model that we have, which seems a profit over people. I mean, I call them nasty grams, these letters from insurance companies telling me that I'm spending too much time with my patients compared to my colleagues. It was like, well, so this is how I practice. This is what I think is necessary. And, I'm not causing any harm. So why would I want to change, the way I practice? And so it's just really hard, especially for, specialty providers to, number one, stay up to date on all the new changes in medicine. It's just the knowledge is exploding, research is exploding, and it's really hard to stay up on all the stuff. So it's really up to the primary doctors, I feel, need to do a deeper dive into root cause and start planting the seeds of information and education into their patients. It's really all about ultimately how to prevent disease, not just managing disease, but how to prevent it from what were the root causes, what contributed to the development of that disease to begin with. And we're moving in that direction, but we have a long way to go.
I'd be curious your opinion about this. I've heard from multiple doctors who think that there's an opportunity for primary care to get more involved in that kind of lifestyle modification with their patients after a patient goes through the oncology process. So, to your point about how oncology is set up right now, they are incentivized to see as many patients as quickly as possible and kind of get them through the system. And then these patients are kind of left in survivorship. Maybe they take a ctDNA test and they find out that they have a positive result, but there's nobody there to guide them on their path to wellness or prevention. Do you see there being an opportunity for more collaboration among practitioners to really address the holistic needs of patients? Or what are your thoughts on what a potential fix could be for this?
Oh, absolutely. There's a need. And I could see in the future maybe a medical specialty on survivorship. I know that there's a lot of oncology nurses that are leaders in their cancer program survivorship committees. My committee that I was on was run by a oncology nurse. So this might be an opportunity for nurse navigators, nurse practitioners, oncology nurses to take the lead. And from the start, usually these people are introduced to the patients at the very beginning of their diagnosis. And I think that it's important for people to be aware that survivorship isn't just for a finite period of time. It's really a lifestyle change. And you've got that person that will always be there with you along the way to answer questions or to help inspire you, or if you slip back, to motivate you to keep going. And you know what I'm saying?
Mm-hmm. Yeah, I think it would be super helpful. I mean, I just look back at my own journey, and it is tough for medical providers because you are in such a state of trauma and shock when you find out. And so you're limited in the amount of new information that you can take in. And so I think they're trying to get the patient to move along the path of what they have to do. And
But I think there's opportunity for them to plant seeds. Like, yes. I hear so often, you're losing too much weight in chemo, like go out and have a cheeseburger and a milkshake.
Yeah, there's small tweaks,
there
right?
are small things that they could recommend for them. Like, hey, make sure you're getting good lean protein. Like, make sure you're upping like this if you can. And when you can eat
increase
this,
your water
increase your water intake. That's going to help flush your body. I mean, there's so many things where they could just insert a tip.
Yeah. Well, Sarah and I have had these conversations too about the accountability piece of the patient. We never want to sit there and blame the patient for being sick, right? Because like you said, we'll do that ourselves. We'll come in and say, what did we do to contribute to this? What caused this? What choices have I made to land me here? That's not really helpful. But I do think it would have been helpful for a doctor to say, hey, everybody has a different capacity for toxins. And our environmental toxins are pretty high in our society. And so here are the things you can do to lower your toxic risk. And that's going to help you stay in remission or to slow disease progression. And not only do I think that it educates me, right, on what I didn't know, which is that there are environmental factors that have contributed to me being ill, but it's also empowering. And when patients get diagnosed, it feels like something has happened to you and you have no control. And I think that, if you're talking about the mental health of a patient, helping them see that they have a role in this and an accountability and making them feel empowered to be an active participant of their care could be really powerful. I doubt we're ever going to have a clinical study that's going to prove that out, but I just wonder how different cancer care would look if it was a true collaboration and about prevention and wellness versus just sick care.
Yeah.
Well, I think we wouldn't see the rise in cancer rates that we're seeing exponentially. It's pretty scary, but I always advise patients that they are the most important person in their care team. Like, we can do everything for them. We can treat them. We can provide them resources and support. But ultimately, what's going to promote healing is the patient's efforts, desires, perseverance, beliefs, mindset, all of those things is really what's going to ultimately provide healing.
Yeah, it sounds like, I love that you're an integrative doctor because that means different things to different people. But to me, what I'm hearing from you is that mind, body, and soul is kind of how you approach the human body, correct? Or the human experience, is that it's not just one thing, and that, these are all things that can be worked upon, in collaboration with your doctor.
Yeah, we as a human being are very complex and complicated. And so you have to address whole body health, wellness, healing from multiple different perspectives. The circulating tumor cell biomarkers, I think it has a role, especially if we're trying to determine whether, number one, are the therapies that they're going through working? And if so, great, then we feel confident to continue them. Or if it looks like it was working, but now the cells are rising, we might be able to find different mutation abnormalities because tumors, like viruses, do mutate, and then can redirect maybe therapies or help us to decide which patients will need to have a more aggressive treatment plan versus less aggressive. So I do think that there is a role. I think we have to be careful, though, who we're offering it to and why, and what's the mindset of that patient. Will they be able to manage the results in a safe way?
Mm-hmm. Before we continue, let's do Boobs in the News. Boobs in the News is a fun segment where we read funny tweets by real people or ridiculous news stories.
Boobs in the News, boobs in the news, boobs in the news.
The title of this is Peeled Bananas Left on English Street Corner Each Month Vex Locals. I'll let you process that.
Yeah, probably like, is there some loose monkeys?
I don't know. It says residents of a town in England are trying to solve the mystery of who has been leaving plates loaded with peeled bananas plates.
Jeez.
Loaded with peeled bananas by the side of the road once a month for over a year.
Oh, somebody got some low potassium.
Locals said that the plates loaded with peeled bananas started appearing over a year ago on the corner of Abbey Road and Windsor Avenue across from a local church. One of the residents determined the banana plates were being left on the second day of each month and erected a sign on the spot reading, "Please respectfully, no more bananas. The uncollected plates and rotting bananas leave such a mess. Wishing a happy new year to you all." She said that despite her sign, someone still left a plate of bananas on January 2nd. I've asked around in the local community, but no one really knows and no one can tell me anything.
Someone put a camera on this spot.
Oh, they should. Do you think the city's going to pay to put a camera up to find the banana?
The city, a local resident.
Oh, that's true.
Yeah,
now it's really easy.
Cameras are so easy now. You can get them for like $30. There's the dog cameras. They even have those little dog cameras that toss out treats.
Well, so locals are theorizing that the bananas might be a monthly gift for local wildlife, and some speculated they could be some sort of religious offering due to the proximity to the church. Stop it. Oh my gosh.
My altar of banana peels. Oh my gosh.
This woman says she's become resigned to the presence of the fruit.
Oh my goodness.
I've come to take the signs down because I don't really want to make it like a feud. I don't want it to become a big thing.
I mean, if it's a plate, just pick up the plate and throw it away.
She says, I think it's a special thing for someone and wish them well. But if they could come back and clean up the mess a few days later, that would be lovely. I want to know, what's happening to the bananas? Is somebody taking them?
Is somebody eating them?
Or
are they just storing all their banana peels for a month and then just
They're not they're peeled bananas. It's the actual fruit.
Oh, it's the actual bananas.
Yes.
Oh, man, my brain is
Your brain is not catching up to the headlines, girlfriend. No, these are peeled bananas on the ground at the corner.
That is
on the
kind of
second.
sad. You're just wasteful.
I mean, yeah, I don't know what's happening.
Yeah.
Is this just somebody super bored? I could think of a million other ways you could mess with people that would be more fun.
Yeah, right. And cheap. Bananas are expensive.
That's a good point. There's a cost associated to this prank.
Yeah. I mean, there's costs associated with most pranks. You got to buy the toilet paper to toilet paper someone's house.
Do you know that I have a serious aversion to bananas? It's severe.
Really?
I hate bananas.
Why?
Which my mom always says, I can't believe how much you hate bananas. When you were a baby, you love them. And I said, I don't know, but at some point they became just I can't even. If I accidentally eat something with banana in it, it's bleh.
Oh, so it's the flavor of banana everything.
I can eat banana bread if it doesn't actually have mushy banana in it. It's a textural thing, I think, for me. But I don't particularly love the taste. And do you know, I had a roommate in college who, when she'd get mad at me, would put bananas in my pillowcase.
Hilarious.
So maybe this is her. Maybe she's
how
in
have
England.
I known you for this so long and we've never come across this banana fact about you?
Yeah, no, bananas are a real issue for me. I do not like them at all.
I don't like eating a banana, but I love bananas in my smoothies.
Well, that's the problem is that every fruit smoothie calls for bananas. And I wish I liked it because of the potassium, right? But
yeah, they are also like the highest
sugar.
Mm-hmm.
That's what I tell myself. Yeah. It's good that
you're saving yourself.
I'm saving myself.
Yeah, that's what I tell myself about onions. Like, onions are terrible for you.
Onions are delicious.
Shush.
They're delicious.
If you wanted to get back at me, I'll put a banana in your pillow and you'll put
onions in yours. You're going to stink worse.
I would stink worse, but also onions draw out toxins, so there's that.
Oh, yeah. Well, your head would be toxin free, but you would stink like BO. There's your bibs.
Bibs in the news, bibs in the news, bibs in the news.
So I want to just kind of reinforce something that I think is really important for patients that are listening is this fair to say, Dr. Aks, that everybody at a certain point in their life may have cancer cells floating in their body? It really just depends on whether or not your immune system is healthy enough to address them. Is that a fair thing to say?
Yeah, I think that's been scientifically proven because, a cancer cell is just a cell that went rogue. And, that happens for a variety of reasons. But, if everything is working the way it was designed to work, then our immune system would then recognize that as a rogue cell and seek out and destroy it.
I think that's the encouragement here. And that's what I tell patients who are, entertaining doing these ctDNA testing. It's like they ask my opinion. And we always refrain at Faith Through Fire about making a recommendation. We always tell women, you have to do what's in your best interest and what you feel comfortable with.
But it is our goal to empower them. We want them to have the knowledge to understand the questions to ask and to understand how to think through their decision, knowing that it's not just like, it's usually presented to them like, do you want to do this test? Here's what it will tell you. And that's not always the full picture, I don't think.
Right. No, yeah. I think we're good about preparing people. Like you said, hey, what are you prepared to do when you get this news? How are you going to feel if it's positive versus negative? When women get a positive result and then they come to us just spiraling out mentally, okay, this means I'm definitely going to become metastatic. I don't think that's the case, and it sounds like you don't either. Just because you have circulating circulating cancer cells does not mean that it's going to form a tumor, but this is an excellent opportunity to really hyper focus on your well-being and your health. And to your point, it can be useful information if it's used in a preventative or a proactive way, right?
Oh, absolutely. And part of that proactivity has to do with mindset and beliefs. It's like I'd never liked giving people prognosis because it's a statistical number, an average. And we all know people that have outlived their disease, that they had stage 4 cancer and they were supposed to die and they're years later healthy, enjoying life. And so nothing's really absolute except death and in the United States taxes, right?
Right.
So I think that the power of the mind is also an important tool. If we can help people focus their mental energy on something looking forward instead of fearing what's behind us, that will also help, that the mindset helps with a lot of physiological processes in the body. And one is connected to the immune system and the nervous system, all these things. So empowering people to give them some options, some actionable steps so that they could start working and looking forward and use their physical and mental energies that way, I think makes a big difference.
Yeah, I don't think it can be understated what mindset and proper mental health can do for you. We have a stage 4 thriver that mentors for us, and she's been, living with cancer now 32?
30, almost. I think almost 30 years.
I think she's at 30. Yeah, I think she's at 30 plus years. And she says 100% that if, she never asked about a prognosis, she just lives with the mindset that she's going to be fine. And she has got a better social life than I do. I can tell you that.
Yeah.
So I think you're 100% right. You really have to, but that goes back to that whole person care. I've got a family member right now who's pretty chronically ill, and my biggest concern for her is not even like her physical limitations, it's her mental limitations. It's like when a patient has decided to give up, and I'm sure you've seen this so many times in your practice, it's like when they mentally check out, that's when this isn't looking good.
That's it. I would be able to tell to size people up and know or get an intuition which patients are going to do well with their treatment and which aren't. And a lot of that has to do with their mental wellness, where their baseline is.
Yeah. I think something we talked offline and something that you had said was you could put two of the same people side by side who did the exact same thing health-wise, nutrition-wise, but it came down to their mental health, their forgiveness, like the things that they hold within their body mentally that could be a game changer on just how they experience the entire journey.
Yeah. I mean, people these days, many people have unresolved emotional traumas, whether it's been some kind of abuse or loss of a significant loved one or a contentious divorce or job loss. I mean, there's a lot of traumas that we experience in life that get stuck in our physiology and we don't process it, because society has told us that we have to be stoic.
Yeah, we talk about this all the time, that 98% of the women that come through Faith Through Fire, if you ask them, hey, has anything traumatic or stressful happened to you in recent years leading up to your diagnosis? It's always yes.
Yeah.
It's always yes. And it looks different, but I'm shocked that the medical community is not more focused. And we kind of see it with the whole ACEs, the adverse childhood events, right? We have scientific data now that tells us that if a child has a traumatic event, that they are more likely to get ill as an adult. Mm-hmm. So we have some data that shows that trauma is directly, tied to illness, and yet it's not a part of care. And I think that that's just almost criminal at this point, because we know enough, right, to be addressing this. I do think that the patients that we see who recognize that they have unresolved trauma, or that they just haven't been taking care of themselves, right? They haven't allowed themselves to be vulnerable, to really ask for help. And that's the thing too. People think it has to be some major trauma. I didn't have some major trauma in my past, but I could definitely look back and say, oh my gosh, your self-reliance and your inability to be vulnerable and ask for help when you need it is completely hindering your mental health. Mm-hmm. And addressing that has been so critical for my healing. So I just think there's so much room for improvement. The ctDNA test, I think, got Sarah's and my interest because we see the mental ramifications of it, the mental health component of it, and that's where we're hyper-focused in Faith Through Fire. But I really appreciate you kind of illuminating the pros and cons and just the need for, more intentional, personalized care. Before we wrap up and get your final thoughts, let's hear from our second sponsor.
Thrivent is a proud sponsor of Faith Through Fire. Thrivent believes money is a tool and not a goal. The Gateway Financial Group with Thrivent is local to the St. Louis area and can work with you to create a financial strategy that reflects your priorities and helps you protect the things that matter to you, like family and giving back. Please call 314-783-4214 to schedule a free consultation with one of Thrivent's Gateway Financial Advisors. All right, we are back. I would love for you to leave the audience with just any final thoughts on ctDNA testing, whether they're considering it. I know a lot of people will be listening to this when they're in the decision-making process about this test. So any final thoughts for the audience would be great.
So I would say that before agreeing to having it done, I would encourage people to really do a self-reflection on how would they feel about the results if they're positive? What personal changes are they willing to make if those results are positive? How would that affect not just them, but their loved ones? Because, as a cancer diagnosis and journey is not isolated to the patient alone. It's everyone involved in their life. And then where would there be opportunity? Where is there a need for additional resources and support? And are you open and willing to ask for help? Because, it's all, as we talked about, it really takes a village to promote health and healing. And you can't be a lone ranger.
Yeah.
There you go, people.
Sure. Yeah.
Well, thank you so much for coming on and sharing your thoughts with us. We really appreciate it.
It's my pleasure. Hope you have a wonderful day.
Thank you.
Guys, until next time.
See ya. Thank you for being a listener of the Besties with Breasties podcast. If this podcast had a positive impact on your journey, leave us a review or consider becoming a supporter. You can donate with the link in the show notes or at faiththroughfire.org. This episode was hosted by Sarah Hall and Beth Wilmus, audio and production edits by Innovative Frequencies.